The talk is Let's Talk, Conversation Starters for Connecting with Kids and Teens about Mental Health. And we're going to take just a minute to step back and introduce ourselves so that you know who you're talking to. I'm Jamie Elizalde. As I had mentioned, I'm one of the licensed psychologists here at the Scanlon Center for School Mental Health. We operate out of Iowa City.
My name's Liz. I'm a social worker at the Scanlon Clinic. I do individual counseling, group counseling, and some suicide prevention trainings.
And my name is Arti Kular. I am a clinical psychologist and the Vice President of Education Solutions at WellTrack Connect. WellTrack Connect is a resource that is available to parents of K through 12 students in Iowa. And so I'm excited to be with you all.
So this talk is part of our Nurturing Healthy Minds campaign, which is a way of starting to provide educational services for parents and caregivers so that you can start to understand some of the differences between normal stress and when that normal stress turns into more serious mental health challenges. So this is going to be a part of that series. So we're really excited to be able to start off by launching it. There will be more information and a link to the Nurturing Healthy Minds campaign at the end. We're going to go over some resources, so we will review it again then. So kind of just to jump in, here's something to get you thinking about the need. Nearly 3 in 4 parents are extremely or somewhat worried that their child will struggle with anxiety or depression. So the campaign that we're launching and also this presentation are created because we recognize there is a high need, and we want to start doing more to be able to address that for families and children. A brief overview of our agenda for today. We're going to just do a glance at the developmental stages that children go through, and then talk about strategies for speaking to your children about emotions and emotional well-being, and when it's time to seek additional help. What are some signs that you might look for, things to think about? And then strategies for talking to your child about therapy, should that be the next step. And finally, as I had mentioned, we'll go over some resources at the end. So just a quick note on age and developmental level. We're going to guess that all of your children are not the same age, and also they're all individuals. So we want you to take what we say, but make it applicable to your child's unique situation. So think about their developmental level, not just their age, but where are their language skills, their ability to comprehend and understand, and think about ways you might be able to tailor parts of what we discuss to meet your child where they're at. And one way to sort of think about this is using Piaget's cognitive development model. So this is not a specific model that the rules are set on the ages. Think of it as more of a guideline. Children develop at very different rates, as I'm sure you're aware, just by personal experience. But this might give you just some milestones to think about when you're thinking about how to frame things for your children. We're going to jump right into the blue slide, the second one, which is ages 2 through 7. So at this age, children tend to be pretty egocentric, which means they're thinking about themselves. They're thinking about how they affect things, not really about other people's reactions. So this perspective taking is limited for them. They're also pretty concrete. Even though they're starting to develop symbolic language, it's not there yet. So you really want to think about the way that you're conveying information to them and how they're able to take that in. And even though they're using language, their thinking skills are still quite concrete. Around age 7 to 11, children start to recognize that their thoughts are unique to them and that not everyone necessarily shares the way that they think and feel about things. They also start to develop more logical thinking. The important pieces to this is that they still might not necessarily be able to predict what other people are thinking and feeling, so kind of looking ahead. And also, they're very much based on what they can see through their senses. So it can be difficult for them to make some leaps and take some guesses based on things that aren't visible and tangible to them. Around age 12, we start to see more theoretical, abstract thinking. that children start to see themselves as more different from others and that they think differently and feel differently, and their identities start to develop as something separate from others. Morality and ethics really start to kick in around this age too. So we really want to start to think about all of those different things that happen developmentally for children.
So with keeping your child's age and where they might be developmentally in mind, let's start talking about how to approach these conversations. There's a million different ways to approach these conversations, which sometimes I think is what makes navigating the situation overwhelming. And so hopefully to help alleviate some of those feelings, we've come up with a formula, we call it, when approaching the situation. This is something you can use regardless of age, just adjust it based on your child's needs. You know your child best, and that's going to be important to remember when approaching these situations. Use language you know they'll understand and respond to better. And like Jamie said, the developmental stages are something to keep in mind, and you know your child best when approaching these situations. And so the formula is observe and label, or observe plus label, which ideally will equal a conversation. And so what do these components mean? The first one is observe. It literally means to notice and to watch. So these are things that you're noticing and watching your child do. And some things that you might notice is body language. So what are they doing with their body? Are they making eye contact with you? Are they closed off? Are they kind of slumped over? Like, what are they doing exactly with their body? And then what actions are they doing? So are they going to their room to be alone for longer periods of time? Are they not wanting to hang out with their friends anymore? Are they avoiding family time, if that's something that's typical for you? Are they slamming cupboard doors or their door rooms? Things like that. What are some actions that they're doing that you're noticing? And then words. What are they saying? The literal content of what they're saying too, not necessarily what you interpret that to be, but what are the words that they're telling you? If they're using a feeling word, what's that feeling word? If they're saying, I don't want to be around anymore, taking that and noticing that as well. And we're going to get into some of those specific situations here in a bit, but you're just kind of noticing and observing some of those things that are going on. And once you take note of those things, you're going to label them and kind of bounce them back to your child. So you're going to put to words what you're observing by describing it to your child. And you're going to do this non-judgmentally. So just stick to the facts, kind of actions or things they've said, and repeat that back to them. Again, no interpreting at this point. And then be sure to label the emotion. So this might be kind of a guessing game. If they've used a feeling word, like they've identified a feeling word, repeating that back to them is important. And they might not have used one at this point. And so kind of taking what you've observed and kind of guessing what emotion they're feeling and giving it back to them. I think giving them space to correct you if you're wrong about that feeling word is really important in that situation. But just kind of like giving them the information you've observed from them, putting a feeling word to it, and then giving them space to either identify that or not is going to be a huge component of starting the conversation. So we've given an example at the bottom. It's a lot of words for just how to phrase a sentence. But the example is it looks like or sounds like you are feeling frustrated that you cannot get the answer to the math problem. And then just leaving it at that and seeing what they say about that. And again, giving them space to correct that. Again, you know your child best, use your judgment, and see what they have to say at that point forward. Describing feelings is hard. No matter what age you are, it can be a hard thing to do. And it can be an overwhelming experience to put feelings to words and to talk about that, especially for kids. And so these are just some ideas we're throwing out on if your child's having a hard time describing how they're feeling, you can use visuals, and these are a couple examples of that. We just got them from the internet. You can Google them and find other ones that might be better suited for your child. But what we like about these two is that the one on the left has a facial component to it. Some kids respond really well to that. And then the feelings wheel, you might have seen some examples of that. It kind of gives some a wider range of feeling words and then colors with those feeling words. Sometimes kids can kind of have fun with identifying feelings from those. But also don't get confined to one or trying to find the best one by Googling. If you're in a situation where you don't have it readily available and you want to use something, I think just get creative. Want to draw on a piece of paper or have them draw on a piece of paper how they're feeling. Whatever's going to help them express how they're feeling is going to be the important part of that conversation starter. All right, with that said, one thing that is going to make this approach more likely to work is if you, parents, are modeling talking about your emotions around your children wherever you are. So modeling is an effective teaching strategy, and using it in these scenarios is important for your child to watch how you put to words what you're experiencing. And by you modeling that, they're going to start repeating that pattern, ideally. It gives them also an opportunity to experience that maybe they're not alone in experiencing wider ranges of feelings and situations. And so it can kind of give them an opportunity to realize that they're not alone in those situations. And do it for all emotions. We tend to pick up on, I think, negative feelings and situations. And it's important to model this behavior for good and bad, and everything in between. We're always feeling an emotion, whether or not we're aware of it. And so I think modeling that to your child is really important. So for this top one, we have an example. You might say, I can tell I'm feeling excited because I'm smiling a lot. So you're tying that feeling word to how you can tell you're experiencing that feeling, and you're modeling that for your child. Also, when relevant, model coping skills and then how you're using them in situations. For all the reasons that I've said previously, this is important for children to experience how they can cope through their emotions, good, bad, and ugly. And so something you might try saying is, I'm feeling disappointed because our flight was delayed. Even though I feel disappointed, I understand that I cannot control this, and I'm reminding myself of the fun we will have when we get there. So again, you're just modeling those things for your child.
Sorry about that. I just realized I was muted. An important part of discussing feelings and emotions with your child is being ready to talk about the topics of suicide and self-harm. So we're going to actually go over some ways to think about that and apply the formula Liz was using to those topics. But first, there's just a few things we want to take a step back and have you think about. So first of all, we know from research that asking about suicide and self-harm does not increase the risk of suicide and self-harm. So we want you to have that understanding and knowledge, because it does seem scary and it does seem like possibly you could be suggesting something. And in fact, that's not what the research shows. We also need to be really direct in our language. This is a really difficult topic. It's hard to talk about. Your emotions are understandably wrapped up in this as well, if it's something you're concerned about. And we don't want to use ambiguous language. Some of this is tied to the developmental considerations earlier. And also, we just want to make sure we're on the same page. So if you say something like, are you saying you don't want to be around? Or do you feel safe? Or are you going to hurt yourself? These could mean different things to a child. And so we really want to just be very specific about what we're asking. And again, we'll show you that on the next slide. as I mentioned, this is a very difficult time for parents as well as for the children. So we want you to be able to work on some ways to keep yourself calm and to acknowledge this is a difficult thing to do. Take deep breaths if you need to, and give yourself space to have your feelings too. So finally, don't hesitate to reach out for additional help or support at this point if this is something you're concerned about. That's really important. And again, later in the presentation, we will have some resources that you can look at. And if you're concerned about your child's imminent safety, meaning at this very moment, you're not sure that you can keep them safe, that's when you would go to the emergency room. So here are some ways to think about the self-harm and suicide concerns. So first of all, you want to do what Liz was mentioning before. Watch your child's body language, watch their actions, and notice the words that they're using, and also the words they're not using. And label your observation to them non-judgmentally. And you want to ask very directly, are you thinking about hurting yourself? Or are you thinking about killing yourself? Or are you thinking about suicide? So some examples might be, I notice you haven't been joking around like you usually do. So you're seeing these actions. You seem more closed off and withdrawn. You're noticing their body language. And I heard you say, I don't think it would matter if I were there. When I hear these things from you, it makes me want to ask, are you thinking about hurting yourself? Are you thinking about killing yourself? So you can use the same formula. And again, as Liz explained so well earlier, you really want to remove the judgment and stick to the facts. You're basing it on what you've heard from them, what you've seen, and what you're seeing on their faces, their actions, and then asking directly. So a couple of things to think about in general when you're asking about any of these emotions and feelings is to look and listen for entry points to talking about well-being. When your child is open and they're talking about lots of different things, that's a great time to try the strategy that Liz talked about. What do you see? Label them, that emotion for them, and see if the conversation continues. You want to remain honest and direct, especially when you're talking about things like suicide and self-harm concerns. You want to remain calm and try to keep your emotions in check. That does not mean don't have emotions. It means notice what emotions you're experiencing and how they may be impacting what it is that you're trying to accomplish with your child, and give yourself some space. This is really difficult. Validate yourself and the feelings that you're having about the topic, and recognize that you are doing very difficult things and these are very important things. And finally, we wanted to talk about validation, which is just that idea of listening and understanding where a person is coming from. It doesn't necessarily mean that you agree or condone what it is that you're hearing. It's that you're looking at the world through their experience and eyes. So one of the most important pieces is to simply listen and give time. It helps me when I'm working with teens to count in my head to 5 very slowly after I ask a question. Oftentimes, the more emotional a topic is for any of us, the harder it is to give it words. And so that wait time is really important. Allow your child to think out loud. Validate what it is that's valid about what they're saying. Their emotions are always valid, even if the behavior is not. So you can say, it sounds like you were really frustrated in math, and that's when you left the room. You don't have to talk about them leaving the room and how you shouldn't leave in the middle of class. This is you listening to where they're coming from and why they did what they did in that moment. You can validate with words, so you can kind of reflect back to them what you're hearing. Especially important if they're thinking out loud and you really do need to kind of make sure you have the right sequence of events or their perception. You're kind of checking to make sure your understanding is accurate, which also lets them know that they're being heard. And validate with your actions. Give them your full attention. Put other things down, especially if it's a serious conversation or you expect it's headed that direction, and show understanding for yourself too. So we're going to talk a little bit now about the difference between normal stress and some more serious mental health challenges, and Liz is going to tip us off in that direction.
there might come a time, especially I think in these conversations where you're thinking like, do we need to seek additional help? And so we wanted to go over some things to consider before, to help you kind of consider in that process. So these are just some ideas of things to take note of. So for the first thing, and this is generally speaking, this can be for all ages for your children. Some things you might want to consider include what you typically have done, and whether it's not working anymore. And also kind of taking that time frame of trying different things and what you've tried and just kind of observing what that timeline has looked like. Consider any concerns you have for your child's mood behaviors. Again, with that timeline, if it's gone on longer than it seems like it should, it might be a time to seek additional help. When your child's mood or behavior is impacting others to a significant degree, might see their schoolwork, their peers, maybe your home life has changed. That's really something to take into consideration. And definitely if you're concerned about suicide or self-harm thoughts or behaviors. We're going to kind of hone in on more specifically teenagers, because we typically see symptoms for mental health really spike up in teenage years. So this isn't to negate any younger kids or anything like that. It's just that we see an increase tend to happen around these ages. And so anxiety, depression is probably some of the most common symptoms and diagnoses you're going to see spring up. So that's why they're on this chart from the CDC. And you might see other things arise. But generally speaking, you kind of notice that this last column, ages 12 to 17, is really when you're going to start seeing potentially some anxiety and depression. And so with that said, just taken to know where your child is at developmentally, like what age are they, and know what tends to happen around those ages as well. With that said, I know working with parents, there typically is a question of, well, are these teens being teens, or is it something to be concerned about? And there's definitely behaviors that might arise as just a consequence of being an adolescent, a teenager. And there's a difference in the fine line between concerning behavior. And so the next couple of slides kind of map out what some of those things might look like. You might notice like your typical behavior might be more of like increased moodiness as they're kind of growing older. What might be cause for concern is intense, painful, long-lasting mood, risky mood behaviors, suicidal behaviors, things like that. Messy room is not an uncommon thing that parents might bring up, but what might be more concerning is rotting food in the room, unable to find basic needs, and things like that. So just kind of notice what exactly is going on and kind of the trajectory that that behavior is on. Is it getting worse? And what's the timeline look like? Some more ideas on things to keep an eye on. Sleep tends to be a big thing. If they're a night owl, like that's not uncommon for teens to kind of stay up late. But are they staying up all night, sleeping all day, and routinely missing school? It's just something to kind of keep tabs on. With that being said, with all those things that you've taken into consideration, maybe you're kind of at the point where you decide, like, I do want to explore therapy. Arthy's going to talk to us about maybe how you go about that conversation with your child.
Thanks, Liz. So to just kind of set the frame, I will say that talking to your kids about therapy, regardless of their age, is really a pretty amazing opportunity to build trust with them, to create intimacy between the two of you. It's an opportunity to normalize mental health care. And it's really to set them up for seeing therapy as a positive and empowering resource, both now and in the future. And so to really think about this as setting the stage for perhaps future conversations as well. And I think the key to the conversations or the points that we're going to bring up today, because there's so many considerations. One is just really what Liz and Jamie were talking about, which is no two children at the age of 13 are the same, but you know your child best. And so I've broken down these tips or these, template language type things to give you an idea of types of things that you want to be talking through or thinking through. But you know your child best in terms of their developmental stage if that doesn't match with the age ranges that we're providing. And so I've bucketed the children into three main groups. So younger kids, 5 to 10, and then tweens, 11 to 13, and then teenagers, 14 to 18. And so we'll start with younger children. And what we're really going to want to focus on and kind of keep as the larger frame of the conversation is an idea of keeping the conversation simple in language they can understand, positive and reassuring. And so the language that, I would to just kind of give you some ideas of how to think about it. But again, this is just ideas, not necessarily a script. Is framing therapy as a helpful, friendly experience. So you could say things like, we're going to go see someone that helps us understand our feelings and solves problems together. You could say something like, the therapist is kind of like a feelings teacher. They help us understand our emotions, like how a teacher may help you understand or learn how to read math or how to do math or read. Another thing you're going to want to do is reassure and normalize therapy. So like comparing it to something they might already know. A pretty easy one is like going to the doctor for a physical. So for example, like sometimes we all need a little extra support or help, just like when we go see the doctor when we're sick. And if you're noticing that they're a bit nervous, or they feel like they might be in trouble, that's really something you want to reassure them that they're not going to therapy because they've done something wrong. You really want to communicate that therapy is a safe place. You can talk about anything, and it's there to help you. And if you're comfortable with it, and if you've been to therapy yourself, you can even mention adults go to therapy. I've even gone to therapy myself, I found it really helpful. It's just a great way to get added support when things are really hard. And so again, keeping it simple, keeping it positive, keeping it reassuring, and then attending to what Liz was talking about, really noticing if there's concerns or nervousness or fear, then trying to label that and have a conversation with your child. So for the next slide, wanted to move towards to talking to your tweens, or age 11 to 13-year-olds-ish, I should say. And here we're really going to want to focus on validation, encouragement, and really emphasizing like their voice and involvement in this. And so things that you might want to say or think through is just really acknowledging their feelings. So they may be quite hesitant or unsure about therapy. They may have some feelings about it. They may have heard it from their peers. They may have started seeing it in kind of like pop culture, and they're folks that are going to therapy and have lots of opinions about that. And so it might be important to say something like, it's normal to feel a bit weird about starting something new. And the therapist's job is actually to make you feel more comfortable. And it's a place for you to be yourself and for you to talk about whatever you want to talk about. You also might want to say, like, you don't have to know exactly what to say, or if you don't know what you want to work on, like the job of the therapist is to be there alongside you and support you in that. So you don't have to have it all figured out on the front end, is kind of what you're trying to communicate. And then you also want to highlight their involvement. because at this age, they really want to start feeling heard and feeling validated. So you're going to emphasize that therapy is about what matters to them. So something like the therapist will listen to you and help you with things that you care about. And another thing that you can do is really making it relatable, and comparing therapy to other skills that they might be working on, that they like other hobbies. So if like they're into sports or if they're into musical instruments, you may want to say like, imagine if a soccer player tried to get better without a coach. It would be a lot harder. Similarly, therapy is like having a coach, but for your emotions and your stress. And then back or over to now our teenagers, so 14 to 18-year-olds. If anyone in the room has one, I think you could kind of guess what this slide is going to be all about. And it's really, respecting their privacy, honoring and acknowledging their autonomy and their independence, and also letting them know that you are there with them, supporting them underneath all of that. And it's a fine line, it's a tough one, particularly in the digital age that our teenagers are living in. So with teens, it's really crucial that you're including them in that decision, and that you're in some ways thinking about it as thought partnership together. So you may want to say, like, especially if you want to suggest it because you are particularly concerned about, whether it's loneliness, bullying, isolation, depression, anxiety, you may want to say and suggest something like, what do you think about the idea of therapy? I feel like it could make your life a little bit easier right now. I think it could help with things like understanding the feelings that you are currently, working through, or helping improve your friendships or other relationships. I wonder what you think, child. Like, how are you? What's your sense of therapy, to kind of get a baseline on what their judgments may be of this? You may be surprised to learn, especially like, as much as there is stigma, there's a lot of folks in pop culture that are very open about their experiences with therapy, and they may have a really positive relationship towards therapy. They may be very curious about it and quite open, honestly, about wanting to do it. And just the nature of bringing it up to your child may be an opportunity to them for be like, yeah, I'd actually really like that. And they would be maybe more shy to bring it up themselves. And the other thing you really want to make sure you're highlighting is respecting their privacy in the therapy. And so really letting them know that the therapy is a confidential space, and that you're only going to know about something if there's a big safety concern. But the space is really for them to get support, for them to find ways to handle things, and not for you to check in on every single detail or have the therapist report back about every single detail. And I think that's just an important thing to highlight in that conversation. And then things like if they are seeming resistant, I think that's something also just important to acknowledge. Some common questions, generally speaking, that you may hear from any child around, that you're talking to about maybe trying therapy is something like, what if I don't like the therapist? That might be a common one. And, you want to be really open to the idea that the first therapist is not the right fit. And fit, in all the research that we see over and over and over again, the fit of the patient or the client and the therapist is of utmost importance. It really is what builds rapport, trust in the relationship, and it's what makes therapy work. And so you really want to be alongside your child and saying, like, that's totally fine if you don't find the right therapist initially. I liked this idea. I heard it once, like finding the right therapist is like finding the right pair of shoes that fit, like really hard. But once you do it, you're like very loyal to that pair of shoes. And so if you don't feel comfortable in them, you will know, and we'll look together to find someone else. Another common question is like, what if I don't know what to say? And again, I think it's important to reassure you don't have to prepare everything. The therapist's job is really to support in guiding and opening up that conversation to help you better acknowledge your feelings and what you want to talk through. And then the other that I think is a common one is, am I going to have to do this forever? And I think it's important to acknowledge, like, it's not at all. This is a joint conversation. It may be a couple of sessions. Let's see how it goes, and we can keep talking with both the therapist, us. It'll be a joint conversation around, if you're wanting to continue this and how it's working, because it may not be the be all end all of everything. So just, generally, again, really, with those three frameworks, depending on the child's age, thinking through those high level frameworks that you may want to hit. So again, for younger kids, focusing on simplicity, reassurance; for tweens, validation, and emphasizing their involvement in the process; and for our teenagers, really respecting their privacy and their independence. I'll turn it back over to Liz and Jamie.
Thank you. It was really helpful to hear how someone else explains it. I really enjoyed listening to the way that you explained it. So thank you for doing that.
Yeah, of course.
We're going to kind of sum up what we've been talking about to this point, and then I will turn it back over to Liz and Arthi to go over some of the resources that we have available. So what we've talked about this evening, kind of overarching messages, are this is difficult stuff that's not written up here, and it's a really important part. And so by observing what you're seeing and labeling what you're seeing back to your child and sticking to the facts, it can help to give you a little bit of space and to notice based on fact what's happening for them, and to open that conversation up. We also know that it's really helpful and important to model mental health practices and well-being for yourselves. This is something, if you remember the developmental stages, even before children are able to use a lot of language and engage in a lot of symbolic reasoning and logic, they are able to model and imitate. So starting at even an early age, you can be demonstrating and modeling for them what good mental health practices look like. And it makes that conversation easier later on. You want to remain calm, notice what you're feeling and experiencing, and work to provide yourself with some self-soothing strategies so that you can have this difficult conversation. And look and listen for entry points to talk about well-being. Listen with another ear as to what it is that the conversation's about, and is there a way for you to do some observing and labeling. You want to be honest and direct and use language that you know is very clear in conveying your message, particularly when you're talking about things like suicide and self-harm. Validate your child's experience and feelings. This is where they're coming from. It's their reality and their perception of things at that point. So being there and hearing them and listening is critical. And it makes it more likely they'll come back again and give you more information and want to have more of those discussions. And knowing the myths, some of the myths that we have as far as asking about mental health and behavior problems. It does not result in your children developing those. And asking about suicide does not lead to suicidal behavior. So understanding some of those myths and the realities is really important.
All right, we're going to go over some resources that be applicable in these situations. Here's an overview of some things we're going to be delving into a little bit with a little bit more information. I'm not going to talk too much about the mobile crisis map, but know that that's available on the Iowa Health and Human Services website. It differs based on county, and so you can go on that website and kind of learn more about that resource. Typically speaking, it's somebody who gets dispatched to your house to provide mental health crisis services. But what is more widely accessible is definitely 988. That's the National Suicide Lifeline. If you're ever concerned and want to use that, ideally with your child present, you can absolutely do that. It's available 24/7, 365 days a year. I would encourage you to, if you haven't already, go onto their website and check out their services and how it's laid out and what the process looks like. In my experience when explaining it to somebody who hasn't used it before, it really helps to map out what that process looks like, and their website has it on there. So If you haven't used it before, it's all the information's on there. There's call, text, chat features. So if somebody's not comfortable with a call, they can text or chat on the web browser. There's also other languages offered for services, as well as deaf and hard of hearing folks. So look it up if you haven't. Some additional mental health help that is applicable in this presentation is the Scanlon Center for School Mental Health Clinic. We're a short-term clinic. We do psychiatry services for children. And we have exciting news. The parent referral portal is now live on the website. And so parents can make referrals. But certainly go to the web browser or the web addresses right there. Go look at our services that are offered. One of those additional services is the SPACE group. It's an 8-week online skill building program. It's going to be running from February 14th through April 11th on Fridays from 12 to 1. And so you can get registered by January 31st. And you can also do that from the web browser. And then Arthi is going to go over what WellTrack looks like for you.
Perfect, thanks. So WellTrack Connect, you will see in the bottom right, or at least in my screen, I think it'd be the same, the login address, the URL, and it's basically the Scanlon Center's for School Mental Health letters K through 12.welltrackconnect.com. And basically, it is a partnership that we have with the Scanlon Center, and it's a referral platform that supports your students in getting care to mental health providers in Iowa. And so the directory has over 16,000 providers nationwide, but it has specifically over 250 licensed in Iowa that are eager to support your children. And so it has a combination of therapists, mental health counselors, psychologists, and psychiatrists and nurse practitioners that can prescribe medication that can support your children in a range of different ages. And so there's lots of, when you create a profile, and you don't need to create a profile actually, when you sign up, it's just going to ask you a couple of really simple questions, including if you are a parent or a parent of a student. And what you'll want to do is just answer yes to that. And then when it says, what school do you attend? You're going to want to answer the Scanlon Center for School Mental Health. Doing that will give you access to a number of features that you wouldn't otherwise get if you just signed in and didn't acknowledge those things. So that's just an important piece to know about. But when you're signed in, you're going to be able to do a number of different types of searches using all sorts of filters to really cater to what your child's looking for. So whether that's a particular specialty or your student's an area of concern that your student has, whether that's bullying, loneliness, depression, anxiety, ADHD, you can filter by all those things. You can filter by telehealth or in person. You can filter by particular insurances accepted. And a nice feature that you'll get when you sign up as part of the Scanlon Center is you can actually run an insurance benefits checker, which will help you. If you put in your insurance information, you'll be able to instantly see what your in-network and out-of-network coverage looks like, which can be really helpful in just getting kind of a sense of what it may look like to pay for therapy. We know that can be a really big barrier, which is part of the mission of the Scanlon Center. And so we want you to have as much information at your fingertips as possible. The other thing is, if you were to feel a bit overwhelmed or not exactly know where to start, you can, a lot of your children's school counselors will have access to WellTrack Connect. The Scanlon Center also has access to it, so can support you in generating a particular type of referral. So if you wanted kind of help narrowing down the list of 250 to a couple that may be a good fit for your child, you can absolutely reach out for added support. But of course, this resource is available to you independently. Students, if they're going to be using it themselves, need to be over the age of 18 or using it with the consent of their parent. And so that's just something to keep in mind. And then there's also some really nice resources for parents that we've created. So if you're on the website, scroll down to the footer, you're going to see particular FAQs for parents. And then we also have these videos that are geared to students and, you know, kind of frequently asked questions around like, what should I expect in a first session? If I'm reaching out to them, what do I say? You know, what type of, how do I know if it's a good fit or not? What do all these theoretical orientations mean? Things like that that may feel a bit overwhelming to you or your child when they're starting therapy, particularly if it's the first time. So again, the way to access the site is right on the right-hand side of the page. And then when you're signing up, you're just going to want to follow the instructions that are on this slide.
And then finally, Jamie mentioned this at the top of the presentation, but like she said, this is part of the Nurturing Healthy Minds campaign from Scanlon Center, which is an educational campaign aimed at equipping parents and caregivers to distinguish between normal stress and serious mental health challenges in their teen or child. And so that website is absolutely a resource to you all. You could go check it out. They have flyers on there available in English and Spanish. There's some videos, practice briefs, coloring pages, things like that. Also, resources on where to go if you need help. And I believe this presentation recording is going to be available on that website following today. So absolutely go check that out. And that's all we have for you all. We just really want to say thank you for joining us and giving us your time and space. I hope you found this helpful. And yeah, it's if you need access to this recording, it should be available on that website following this presentation.
Thank you all for your time this evening.
Thank you.